When wounds come to us, they're stalled. They're not progressing, and there's a reason for that. And that's what we do here at the wound clinic, is try to figure out, why is this wound stalling and not healing through the normal process?
I feel like sometimes we're a detective, because usually a wound is a result of something else. It could be their comorbidities of diabetes, venous stasis, arterial disease, and we have to figure out why this wound is there and what we need to do to help it heal. What I enjoy with wound care is the bigger, gorier wounds. I like seeing it when they've just been debrided in the operating room and it's this huge wound, to then seeing them through the wound care process and seeing their wound heal and hitting those little milestones with them, because we see these patients for a long time and they become a staple in this clinic, and I know we become a staple in their lives. We can truly feel the impact that we make on them as we watch their wound heal.
Good morning. How are you today? Great. Good.
In 2009, when the wound clinic opened, a lot of patients were coming in and getting inpatient treatment, but then as they left and went out into the community, because of maybe their health conditions such as arthritis or their eyesight, or it could be a variety of reasons, they weren't able to do their dressing changes and care for their wound. So we developed this outpatient wound clinic so that we could continue to monitor those patients after they were discharged from the hospital. I guess the thing that I love the best about the wound clinic is that we're, number one, comprehensive, and also that we see these patients from inpatient to outpatient, and then if the need arises, we can refer them to home health. So our home health nurses can go out into their home and follow up with their wound care in their own setting.
I think what makes wound care interesting is what happens outside of the patient room. There's so much collaboration between the nurses and the providers. We have this very trusting relationship that you don't find in many departments. So when you have that really challenging wound that we've tried all these different things and finally something is working and we can see the progress in their measurements improving, it's a total win, and it makes everyone's day.
I guess we're all on the same mission together, which makes for a really good team. I love our physicians. We have surgeons, we have podiatrists, we have infectious disease, we have nurse practitioner. We have such a wide base of knowledge that it's just a great place to work.
One of the things that patients will always come and tell us is that, the wound clinic is one of Mary Greeley's best kept secrets, and hopefully patients and staff will realize the great care that comes out of here because of our great team.